Hello, my name is Caleb Lau, and this is my video presentation final for the Emergency Response Communication and Documentation class. The topic we will be covering today is the problem and difficulties that EMS providers run into when they have a patient that does not speak English. We will be covering the problems and some of the tools and solutions that different EMS providers implement and use in order to communicate with these patients. In EMS, we are here to treat and serve the public. It is not too uncommon in the United States to run into patients that are non-English speaking, whether that be more commonly Spanish or in certain parts of the US, French. Locally, here in Oregon, about 15.3% of our population is non-English speaking, and 86% of that population is primarily Spanish speaking. Now, these numbers may seem small, but that leaves with a 13% chance that a patient that you go on will be non-English speaking and will be Spanish speaking. Those numbers seem fairly high. That's 1 in 8. Most of the time, you can have a family member or a friend of the patient there to translate, but that is not always a guarantee. If there is a friend or a family member on scene that is able to translate for you, you must be careful deciding when it is appropriate or not to have them do so. If it is a serious call, it might not be appropriate just in case the patient can either get overwhelmed or the interpreter can get overwhelmed or the interpreter might get in the way. Now, in the event that there is no one on scene to translate with the patient, it is important to remember what it is that you need to know. On initial contact, you are going to need to find out what is wrong with the patient and how you can help. This is good for your initial contact and for your ABCs. Making sure that any immediate problems you can solve and you can help the patient. This does not take much communication, and there are some tactics that I will show you later that can help out on communicating with patients like this. Once you move on past the initial contact, you'll move into your secondary assessment. This is when you need to remember that you are going to need to get your history, your medications, and the allergies from the patient. This is when it might be easier to break out different tools and different systems in order to communicate with this patient instead of trying to do it all on your own. The initial contact with a patient is a little bit easier. The questions you need to ask are simpler, and the amount of communication that is needed is much less. Some easy questions are you hurt, and where are you hurt? These are specific questions that either leave it as a yes or no question when it comes to are you hurt, and where are you hurt, it gives it to a point of they don't need to explain it to you. They can point or they can mimic what is going wrong. Another important aspect of this is also using gestures. This allows for, if they can't understand what you're saying, they can still get the message through gestures, or if they are hard of hearing or deaf, they can either read your lips or they can actually see what you're mimicking. So when it comes to where you hurt, it's as simple as putting your hands out to where, and they might be able to point and show what is hurting. Another simple yet easy task would be to learn the sign language alphabet. It's not that hard, and really you are still speaking the same language, you're still speaking in English, but it gives you the ability to break through that almost language barrier when you are speaking with a hard of hearing or a deaf patient, because you still need to be able to communicate with them, and it's as simple as the regular alphabet. There's A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. Knowing the alphabet will allow you to slowly but still efficiently speak to the patient, and most hard of hearing and deaf patients are able to speak English, they just obviously can't get the input, but once you get your message to them, they will be able to then speak to you to make sure that the communication is still there and they can still get the treatment that they need and they deserve. After you ask these questions, you should be ready for some common responses. These are words that are not too difficult to understand but would be very helpful, whether it be head, chest, stomach, arms, or legs. These are all common areas that they can generally say to you, and you can clarify by pointing and by gently gesturing towards just to make sure that you have it correct. But if someone says mi cabeza is hurting, that means their head is hurting. Or if they point to their chest, then that might mean that their chest is hurting. Once you have moved on to your secondary assessment and you are trying to get more of a background on the patient, when you need to get a history, any medications, or allergies, this is when it would be smart to either call an interpreter line or use a smartphone app to be able to translate for you. It may seem weird, but it is a tool that we have at our hands in the front lines of EMS and should be comfortable with using. We're going to be using the Google Translate app for some examples. Do you have any medical history?
¿Tienes algún historial médico?
So the second time that it beeped there, it gives the patient a chance to respond. So not only can it translate you from English to Spanish, but then it can listen and translate them from Spanish to English. This is very useful in not only be able to send a message from you to them, but being able to understand what they are saying back. So more examples would be, are you taking any medications?
¿Estás tomando alguna medicación?
Do you have any allergies?
¿Tienes alguna alergia?
These are very useful tools at our fingertips that a lot of people should be comfortable with using. And as easy as downloading a free app on your phone that is both available for iPhone and Samsung app. Another cool feature of some of these translation apps is their writing feature. With this, you can have the patient or yourself write in your own language, and when you hit translate, it'll change it into their language. This will help determine what language they were speaking and make it that way they have a clear definition of something to read. That way it's not trying to listen through the speaker of the phone or trying to listen to any other device. It is clearly written. That way if it's a busy ambulance or if it's a busy ER, if it's a noisy scene, if any of these things are inhibiting you from being able to speak to the patient or the patient being able to hear the phone, this will help out in that scenario. Some other tools and resources that are used in the field of EMS for translation are interpreter lines, video interpreters, and laminated cards. Interpreter lines are really popular in the field of EMS and even in hospitals. They usually will come with the phones that you are given for your shift. You can call the interpreter line, you have to enter in your code and try to guess what language you need to be interpreted. And this will contact a professional that will then be able to speak to the patient and determine exactly what language, and then be able to interpret over speakerphone. That way you can speak to the patient. In a similar vein is video interpreters. These work a very similar way. They're more popular in the ER, not so much out on the ambulances and on calls, but they set up and they are set up as a FaceTime or as a Skype call where you call the interpreter, and as long as you know what language you need to be translating to, and they will be able to speak the patient for you, relaying all your messages to them and their messages to you. Finally, in some local agencies and some smaller agencies, they have laminated cards. These cards will show pictures and diagrams that help determine and communicate to the patient, while also providing phonetically spelt words. That way you can translate to them and they can translate to you. These are very useful when it comes to just simple tasks, but when it comes to more of a detailed history, an interpreter is definitely the way to go. Some important reminders when it comes to dealing with a patient that does not speak English is that it is very difficult to get an actual refusal form if the patient does not want treatment. You have to remember that you have not legally portrayed the dangers that they are taking when they deny ambulance service. So don't check with your agency on what you need to do when there is no communication line. And you also must remember, if you are transporting, to let the hospital know that you're transporting a non-English speaking patient. That way they can have a translator on site for when they go to do their assessment and for when they go for treatment. So all in all, we realize that the language barrier that is between provider and patient is very much an issue. But as technology progresses, we realize that it is getting easier and easier by the day to overcome. I hope that this presentation helped you